Centre for Health and Clinical Research is a vibrant research centre with a wide range of activity. It includes long-term conditions, mental health sciences, emergency and critical care, also public health and wellbeing, public involvement in research, health ethics and society, child health and service evaluation.
In my job, quite a lot of what I do for both undergraduate and postgraduate students, especially for postgraduate students, is helping them to think about their career and their academic plans for themselves. Actually helping people to see what's available to them, how they might get there, and what their potential might be.
Well, I am quite heavily involved with the undergraduate programme, so particularly in the final year. I actually teach a lot of the research methods to students on the physiotherapy programme, but also on the occupational therapy programme, and I do sessions for the radiography students as well. But really sort of help them to develop their research knowledge, their research skills, their ability to read research literature and understand research literature, and then to be able to integrate the findings of all of that into their own practice and their own learning as well.
In terms of learning more about research, there's an opportunity to learn from a wide variety of researchers at different levels from different professions about what a research career looks like, the opportunities within that, but also the practical day-to-day things of coming up with a research idea, developing that into a workable project, getting the relevant ethical approvals, collecting the data, and then of course analysing that data and publishing.
So I've contributed a number of chapters to a variety of mental health nursing textbooks. And I think what you're trying to achieve, or what I'm trying to achieve when I'm writing those chapters, is to distill and synthesise a lot of the research that we've undertaken in a way that's understandable and digestible for undergraduate nursing students.
Another way in which I use my research to help with student teaching is that I can use the research papers that I've published, both qualitative and quantitative research, as ways of helping students learn about evidence.
We use mixed methods approaches in the work that we do, and I think these are useful examples of research in progress that we can share with you as students.
We have a very strong research community here for speech and language therapists. It's quite unique in the country. There are very few places where a speech and language therapist can do a doctorate and be amongst other speech and language therapists.
The funding for our research we get from a whole range of different sources, from the Department of Health, from the National Institute for Health Research, from Big Lottery, I work particularly with the Soil Association, from Bristol City Council, who funded us to do various projects, so a whole range of different funders.
I've been here at UWE now for just under a year, having worked for over 20 years in the National Health Service. And what really stands out for me is the way in which there's a real commitment here to bridging the gap between academia, universities and the real world environment of clinical work.
So our students have a combination of theoretical learning but also student placements in a variety of practice environments that are relevant to their area of study. So it's nice to meet students. We get students come up here to the air ambulance from time to time. We get students come to the hospitals, and obviously they're always interested in emergency care. It's the kind of thing that often inspires people to go into healthcare in the first place.
Last year we had one student who had already graduated, who worked with us intensely with the Keeping Children Safe work. She was involved in all aspects of the study that she could be, and was a real asset to us. And also it enabled her to develop her skills, and she then applied for a job that she'd been hoping to get and was successful.
My plans for the future are to pursue a postdoctorate and hoping to become a leader in healthcare research. All of my achievements so far are due to my positive experiences at UWE.